Hey again, this is Sudarshan with Revive Spine and Sport Physiotherapy and Chiropractic Clinic.
Hi, I'm Shiva, physiotherapist.
And I'm Dr. Shane Samuel, chiropractor. In this video today, we wanted to go over kind of a look at what's inside of our own heads when we see a patient come in with neck pain. And today you're actually going to get a few bit of things you won't find if you do a Google search on neck pain, because we're going to go over what we think of when we're assessing that individual patient. And you're going to get a little bit better look at why a team and a based approach towards pain is really important. So I'll take that to you, Sudarshan, and I'm going to ask you the question is what goes through your head when we're dealing with someone coming in with neck pain?
Thanks, Shane. The first thing I try to do is not to have a standard model of putting everybody into one category. I try to divvy up all our clients into three basic groups, if possible, or a combination of those groups. The first folks are put into the myofascial group, where the pain can be sourced from a muscle and the fascial structures and the associated movements that come from it. The second group of folks are the musculoskeletal group, where the joints and the bone itself play a role. And then the third group of patients are the neuromuscular, where the nerves play a significant role in contributing to the pain. And then, upon evaluation, once it's divided, a treatment model is devised on an individual basis, and as no two individuals are one and the same.
Yeah, and when I see a pain of myofascial origin, then my approach towards treatment will be like mainly strategizing into active and passive treatments. My active treatment strategy will be prescription of exercises, strength and conditioning, stretching, counter strain and counter strain mechanisms. Whereas a passive treatment approach will include needling, hands-on myofascial stretch, myofascial release, things like that.
That's excellent. When I'm dealing with something that's musculoskeletal origin or that has a musculoskeletal component involved within the pain, I really have to look at what's the point or what is actually happening with this patient, because we have to start looking at what is the reason for the pain or the offload to begin with. So I like to look at the actual mechanical load that's placed on particular structures, and that starts with the bones and joints and how they interact with the muscles around them. So I like to treat them also in an active way, in a passive way. We'll use stretches, we'll do different loading strategies for exercise. We'll utilize mobilization of joints or actual manipulation of joints or chiropractic adjustments. We'll utilize dry needling as well in different forms of myofascial release, and maybe even some posture correction to be able to change some of that musculoskeletal pain.
From a neuromuscular perspective, I look at the entire path of the nerve from its origin, from where the spine is to where it ends. So there are multiple places the nerve can get irritated. Sometimes, if you believe me or not, an irritation of the lower end can cause upper end irritation as well. So we can't just focus our attention just at the neck. If somebody comes to us with neck pain, it could be actually coming from the nerve getting stuck at the wrist area. So these junctions where the nerves are actually passing through different structures are called the interface. And the interface itself can become a problem that needs to be addressed if you want to actually address the overall pain and the recovery.
Yeah, and also well said, and also pain is multifaceted, it's like a biosocial, psychosocial approach. So we need to look into different aspects of the patient, which is a priority, and we can navigate our treatments accordingly as well.
From a psychological perspective, what do you normally suggest?
We want to see if it's a chronic pain, if they're anxious, the fear of movement, or how much of a depression or other sources of stress that's kind of enhancing the pain limits, and see if we can kind of talk about that to the client and kind of do a psychological referral so the psychologist can take over and kind of work on that component.
What do you think about the group practice there?
The group practice is actually really nice, because while we all have our own individual skill sets to be able to deal with these things, it's really nice to come together to be able to have the same framework of mind, and that's something that's very important when it comes to individual based recovery. See, it's not just putting a towel under your neck and seeing whether or not that improves. We need to be able to take whatever component from either of those categories, or maybe it's a combination of them all, and even using one or two of us in conjunction to be able to get the end result that we want. And that has to go with patient satisfaction. That has to go with movement improvement. That has to go with improving lifestyle. So,
sleep, hygiene.
Yeah, definitely. Yeah, for sure.
Yeah.
Thanks for watching the video.
Please like, share, and subscribe.
Thanks.
Thanks.